Welcome to Insurance Insights, Insurance Simplified, where I break down insurance products to make it easier to understand. And the title of this video today is going to be Ignorance is Bliss, but it may cost you. Reason I've titled that is because I'm going to be kind of going through an example actually of a real world case that I'm right now kind of in the middle of where a client has really kind of been misled and kind of brought down an expensive path to getting their health insurance. And luckily, you know, I ran into them and have been able to help them find better coverage. So I'm going to share with you some of the details of that story, and it's going to be a good way to show you the differences of coverage that are available out there and the pros and the cons of both, and why I really recommend one over the other for the most part, but also some special opportunities that are available this year. Now we're getting close to the end of the year. It's August. Maybe would have been good to have this video out earlier in the year, but still there is time. So let's go ahead and jump right into this. Essentially what's happened is I met a family of 7. They have been enrolled in short-term medical for the last few months at the advice of their, you know, kind of a friend broker, family friend, and, you know, he basically told them that, oh no, you don't want to have the ACA, what's known as Obamacare plans. It's not good coverage. You're going to be frustrated, all this kind of stuff. And instead he enrolled them into a short-term medical plan as if that is better. And the main point of this video today is really show you the differences between those two options. And again, I'd say 9 times or 8 times out of 10, the full medical coverage is going to be better if you can get in. And that's a very specific point of this video too, is that this year specifically, there are some special opportunities related mostly due to the COVID situation. There was the Affordable Care Act, or sorry, the American Rescue Plan that was enacted, and there's some provisions in there that are effective this year, particularly that anyone who is under a certain income level, which is 150% of the federal poverty level, if you're below that, then you can enroll all year long. And essentially what this broker really chose to do, again, ignorance is bliss, and I think it was a bit willful on his part, if you ask me. He just, you know, really overlooked this provision. He could really help this family out. Beyond that provision, there's also another provision related to COVID that if you lose your health coverage anytime since the year 2020, the beginning of the year, which is the beginning of the pandemic, that also qualifies you to get in. So this family actually had 2 good opportunities or 2 good reasons to enroll what they call a special election period. And again, either this broker just didn't know, which is dangerous in its own way, or just neglected to know because it benefited him. He was able to put them into a short-term plan that was costing the family around $2,000 a month. We've been able to get them enrolled in much better coverage for around $300 a month, covering the entire family. So I'm going to go ahead and show you how that works. I'm going to show you the differences as kind of briefly as succinctly as I can between short-term and that full medical and why it's better. Now, these plans are usually really only going to apply in a situation where you don't have employer-offered insurance. If you have employer-offered insurance, usually that's your better option, even if it's not as affordable as what we'll be looking at. It comes down to whether or not the your employer-offered insurance is too expensive, which is a rough number, would be usually more than 10% of your monthly income. So if you are paying more than that for your employer insurance, then this might apply to you. So let's go ahead and just jump into this. I'm going to start here. As you can see on the screen, this is United Healthcare site. You can go to this yourself. This is a public site. This is the short-term product. All right, so we're going to look at that, and that is exactly what he had them in as well. Now, I will say I like United short-term product above most of the others. It just has a lot of options in it to kind of build coverage that is closer to full coverage than most of the others, and their prices are usually pretty good. So it's a good example for this case here. We're going to go ahead and just pop in a zip code. This is the zip code that I reside in, Florida, Seminole County. And then we're going to put, just for the kind of example here, I'm going to go with someone who's about 28 years old, so 1995, and kind of explain why. And we may look at some other ages as well, but this should really get it done for us here. And so you can see down here, this little checkbox, actually take this off. It's saying I'm looking for Affordable Care Act health insurance, which is that full coverage ACA plan, Affordable Care Act, or more commonly known, Obamacare. And this broker really has a responsibility to make sure that he is looking into every case that he writes and make sure that they do not qualify, which if he would have done his job, he would have seen that you could have saved him a lot of money, but he would have lost a lot of money. So I think there's some rhyme and reason there. So let's go ahead and look into these plans. All right, so now I've got it loaded up here. The plans that go up to just 12 months. And there's several different options in here. What I do when I'm going into these plans, because they're already such limited coverage and it's just not really offering a lot of benefits, what I kind of do is I strip down the core insurance there to really just catastrophic, really to save money, keep the costs low, because when I'm going into these plans, that's really the objective. Give me the lowest possible coverage because you're going to be paying out of pocket for most of your services anyway. Some of the plans will have co-pays there, but you have to hit the deductible before the co-pay kicks in. It's likely unattainable. You're paying a higher premium for those plans. You're paying a higher premium for the lower deductible. It just gets very expensive. So what I'm going to design this as is to get the most cheapest, overall best coverage here. And what I like to use is the hospital and surgical plan for that. So I'm going to open up the details on this plan. Most brokers are going to go like a short-term medical value, acting as if that's a good, effective plan, but it's just not, because again, you have to meet a huge deductible that you're probably never going to hit, and your plan's just more expensive. So with this plan here, I can actually reduce the deductible down to $5,000. The drawback is still here that we have once we hit the $5,000 deductible, we still have a $10,000 max out of pocket to hit, and that's going to be at 50/50, all right? So unlike some of the other plans we're about to see in a bit here, the deductible does not feed your max out of pocket. You hit that first, and then you have to go into this out of pocket max. So this plan here, true max out of pocket, is $15,000. Let me give you an example here. If I have an accident where or a hospital stay where it's $25,000, well, I would pay $5,000 first, right? Then that's going to leave $20,000 there left over, and I would share that cost with the insurance company at 50%. So that $20,000 is then divided between us both. I'll pay essentially the $5,000 plus $10,000. That's the $15,000. They're going to pay $10,000. But I'm fully paid up at that point. Anything else happens in the year is going to be fully covered in this plan. Now, let's say it was a $50,000 accident, same situation. I'm actually only going to pay that $15,000, and then everything beyond that's going to be covered, because once I hit that max of $10,000, I no longer have to share the cost. So again, it's not perfect, it's not great, but it's keeping my monthly down right here at 103. So that's what I'm after. I'm trying to get the lowest cost plan right now, because this individual probably doesn't qualify for subsidies. They're really healthy and they just want to save money but have catastrophic coverage in place. So this is working for that for the most part. Now, another thing that I would probably do with someone who's 28 years old in that range, because they are healthy, unless they have some, things going on, again, it's up to them. We can also reduce the term down to 6 months. The way that this works is that the less insurance you have, the cheaper it is. It's not like going to Costco and buying more insurance and getting a better deal. Instead, you're going to be insured longer, so your deductible lasts longer, and therefore it's going to be higher priced. With this kind of setup, your deductible is going to reset every 6 months, but if you're not really hitting the deductible, it's not really a matter, right? So this is another way to keep the cost down. We went from $100 down to about $80. So again, that's up to the individual, but I'm just really getting this plan set up to be as cheap as possible for our comparison. All right. And so there are a couple other options down here when you scroll here to add on. But before we get there, you can see things are just not covered. Doctor visits, not covered. Preventive care, not covered. And that's fine. I'm going to be paying out of pocket for these services. I would be anyway. Even if I had a plan that said they covered them, I would have to hit this deductible of $5,000 before it starts working. So it's just not likely, right? Unless you're very, managing some very serious issues, then maybe that makes sense. But to me, I'll keep it slim, and I have a way to kind of address these concerns in another way. You can see down here there's some coverage for like outpatient care, $75 copay for an urgent care visit. You get 2 of those per year. So that's, decent. And then again, what I was talking about is some of the supplements that we can add in here. I'm going to do it in a different way, but there is like an option here to do like a 10,000 supplement for like $30. I'm going to explain that a little bit more here on the next thing. So let's go ahead and add that to cart. All right, now we're going to skip dental plan. We don't need that. And then what we're going to do is go to this next drop down here, and we have a couple other types of coverage. And so I'm going to do this accident pro guard, which is similar to the supplements I was just showing you. And so in here, what we're using this for is to cover the deductible and the max out of pocket. And usually those are going to be the most problematic or the biggest concern if we're injured or hospitalized, right? So there's three kind of main areas here. We can see them. We have accidents, we have hospitalization, which is going to be well, so accidents would be like a broken bone, bad burn, something like that. Hospitalization would be something like having to get your appendix removed suddenly. Okay, so you're in the hospital, or COVID, right? It's not an accident, but you're in the hospital for the night or longer. And then the last area here is your critical illness. All right, so that's going to be cancer, heart attack, and stroke. And so we can try to cover those because that's when that deductible max out of pocket is really going to be affecting us, right? So I like the ProGap plan here. Let's go ahead and look at the details of it. And there's more options, but ProGap's pretty good. Now, for someone who is the age 28, I'm really not worried about critical illness too much. And there's some other supplements I would probably use, but this one is just ease of demonstration here. I'd be most worried about accidents because that's like the highest probability of what's going to happen, right? Have a bad fall, break a bone, something like that, maybe a bad burn. And so the accident benefit here, I'm going to raise that to $7,500. That also raises the critical illness, just part of this particular package, which is okay. But why I like this setup for this example is I also get that hospital sickness benefit. It's only $2,500, not the greatest, but again, I have a way of filling that gap just a little bit. So in this situation, we got $7,500 for accidents, $7,500 for critical illness, $2,500 for hospitalization. These are going to pay out. Let's say I have an accident and it's a $10,000 accident. Well, I'll get $7,500. If I have an accident that costs $5,000, well, I'll only get that $5,000 because it only pays up to that. If I do have a critical illness and somehow it's only $5,000, well, I'll get that full $7,500 because critical illness pays out lump sum. The accident just pays out to the cost of the injury. But again, this is going to help with that $5,000 deductible and that further out-of-pocket expense of $10,000 that we have. So if we get a $10,000 bill come our way, and this we can get that full accident policy or critical illness policy kick in, then that'll reduce that $10,000 down. We'll have about $2,500 on our hands, roughly speaking. So let's add that to the cart. All right. And then they've given us an option here for the HPG choice one. And yes, I want to go ahead and look at that. Let's see here. Let's view all of those plans. And this is how I essentially build this very low level coverage, that hospital and doctor protector. That's not like the short-term plans, and it's very slim, but I'm going to add the HPG in there. And that's going to take care of a lot of the other gaps, the things like doctor coverage, even some medication costs are going to be covered in there. This is the HPG level 1. And again, for a 28-year-old, this should probably be sufficient, but there are several different levels that you could consider. So we're going to open up this brochure. All right, and now let's just go ahead and scan through this real quick. I'll kind of show you some of the benefits that are helpful here. So unlike the short-term plans, that if I would have paid like the copay plan or some of the better plans that are really expensive, I still wouldn't get a wellness exam. So in this coverage here, I get, a wellness exam is covered, one per year. All right. See that right there? I get 80 per exam. Now, this plan, the way it works is an indemnity plan. It's a little bit of a hassle. You're going to go pay out of pocket first, and then you're going to submit your bill, and they'll reimburse you. So for that wellness exam, I'll get 80 bucks. Not bad. That exam will probably cost $150 out of pocket. It ultimately comes to about a $70 copay. So that's pretty good. And you can see some other stuff here. Mammogram for females above 30, they get 100 per exam. Colonoscopy, that kind of fun stuff. If you meet the requirement there, age 50 and older, you can get 300 per exam on that. So a nice benefit and a good time. And so then we have doctor visits, specialist visits, and even some urgent care and some surgery, like in-office surgeries here that would be covered. And so you're going to get 4 of those types of visits per year, and any combination of those 4. So maybe 2 doctor visits, 1 specialist, and 1 urgent care. And now our short term, we pay $75 for urgent care, but this plan pays us $200 for that urgent care. So it's essentially like we make money on that urgent care visit. $125 we'd essentially get paid. So that's where these indemnity plans are nice because they stack on that coverage. All right. Then next we have some chiropractic care in the other plan, so it's not in this main one, so it's not too big of a deal. If you need that, you can upgrade your coverage, but again, we're keeping it basic on this one. And then we have even medication. Name brand, we're going to get 40 per fill. Generic, we get 10 per fill. And you're going to get 12 of those per year. All right. And then down here, we even have some further coverage. We have inpatient hospitalization. We'd be getting 1,000 per day. So that stacks on top of that, and that hospitalization benefit for 2,500. So each day is 3,500, another day at 4,500, and so on. And there's some other benefits here: intensive care, hospital admission for first day inpatient, you get 1,000 per day there. Emergency room, you get 400 per day, and get 1 day there. Again, it's limited. Even some ambulance coverage. So there's some additional coverage. So this is a pretty, overall, if we go ahead and add that, we have some pretty good coverage over here. Overall, this is how I designed the plans. Let's go ahead and X that out. Now let's kind of just look at what we're running out on a total here. We're going to look at the cart. So if I have my back against the wall and there's really no other option, I can't get that person into the system for whatever reason, then this would be a pretty good setup here. Okay, let's see, just make sure everything is set right. So we got this deductible here. And yeah, we have a plan down here as low as $160 a month, so it's not bad, all right? So again, this is a 28-year-old. This will probably be pretty good coverage for them, all right? So now let's go ahead and look at the full medical coverage and really see how that compares. So over here, again, I'm going to do the same thing. I'm going to 32765, that same area. Okay, and we're going to do same date of birth, 0101, 1995. Both of these were for a non-tobacco user. Okay. And then we're going to have, these plans are based upon your income. So I'm going to kind of play a worst case scenario first here and then kind of go backwards. So let's say that this person makes, so much money per year that they actually don't qualify for much subsidy. So let's say about 50,000 for a single person. So this person would not be qualifying for the plans based upon that income. However, they may have lost coverage or recently or since 2022, right? So again, there's ways, if I really want to get them in, I have ways to get them in, okay? And so we can see here, this plan is $184. That's the lowest cost that we have. But with this plan here, and again, this ain't the greatest plan, but how this plan kind of stacks up right away is, they get 3 visits to their primary care for $35 a piece. And then after that, they're going to have to hit the deductible. There's no coverage for specialists, no coverage for generic medication. This is a catastrophic plan, as you can see right here. Okay, so not the best plan, but still decent. Again, the last plan we were looking at is catastrophic. It was a little less, but the max out of pocket on this plan is the same as the deductible. So I have a deductible of $8,700, and my max out of pocket also is $8,700. What's different in these plans is the deductible does feed into the max out of pocket. So it's not like 2 levels I have to hit, unlike the short term. Okay, so once I hit $8,700, I'm covered in full. And so with this plan, if I had a $15,000, $25,000 accident, the most I'll pay is $8,700. So right there, it's already better coverage. Now, let's see if we were to actually go into, and what I like to shoot for in these plans is a lowest deductible plan, a 0. And let's just see where we're at for that, right? Quick comparison. So here we are, $300. It's a lot more, okay? And, again, this is where that individual would probably just take that catastrophic at 180. If they want to save even more money, then we go with the United Healthcare and it'd be okay, right? And so 305, if they're willing to put this in their budget, I mean, they are, after all, making 50 grand a year. So it's in budget. Not the best, but it's there if they're, have medical stuff that they're trying to take care of. This may make more sense. Doctor visits are at $50. Specialists are at $125. Your max out of pocket's $8,700. But if we look inside this plan, there's some other things there that's probably beneficial as well. Things like x-rays, okay? You have that covered at $95. Imaging, like a CT or a MRI scan, that's a flat $500. None of that's going to be covered in the short term. You're going to be paying out of pocket for all that. Blood work, $25. And then if you go down to like your hospital emergency stuff, you have some nice fixed costs for most services. If I have to do an outpatient procedure, let's say, That's $1,200 for the facility, and then it's going to be $350 for the doctor, so about $1,500 to take care of a surgery. And I've had situations where people have done that, like a knee surgery or something like that. So that's a really good benefit there. And these plans do cover what's known as the 10 essential health benefits. So you have mental health, you have pregnancy and birth covered, you have free preventative care. All of these plans come with a free yearly checkup. You can do your blood work that's related to your checkup then, no cost, right? And for adults, there's certain screenings, and for women, there's certain screenings, and for children as well. So these are all free preventative care. You get none of this in the short term. Now we're going to look at a case with that 28-year-old if they're kind of on the other side of the spectrum, making around that 21,000, which is where they would be qualifying all year long to get enrolled based upon their income. So let's go ahead and adjust this now, 21. And I'll show you how these plans kind of stack up. But as we've kind of just seen, you know, even if you're paying a higher cost, you're paying the higher cost because your income's higher. And why would you choose to take that cheaper short-term plan when, if you can get in the system, when, you know, the coverage is just better, right? Comparatively, you're at less risk. Again, some may, but the real problem I had at the beginning of this video that's detailing is that this broker kind of misled this family down a path where they had a much more affordable option and much better coverage. So really not looking out for that client at all. So here we are now. We have this 28-year-old making $21,000. Here we see the very first plan. It's a $0 deductible and it costs nothing. And so that's what I really hope you out there watching this video, if you don't have coverage right now, you may qualify for a $0 plan. Is this the best plan? Not exactly, but something's better than nothing, and at zero, that's great, but there is actually probably better plans here. So let's see what we can do by going to the lowest out-of-pocket max plan right away and see if there's something good there that's affordable, right? So load this up, and right here, right away. Now, I don't think I would take this plan exactly. This is, you know, this depends. This gets into another topic of HSA accounts, so that is a potential option. There's not any coverage in here until you hit the deductible and the max out of pocket of $1,500. And you can also put away funds into an HSA account. Again, that's a conversation for another day. But let's go ahead down here to a plan that could make some sense. So here we have this AV Med plan. This plan's really great looking. $36 a month. The total out of pocket is $1,850. My deductible is $1,850. I pay $40 for a doctor visit, $80 for a specialist visit, $15 for medications, $36 a month, you know? And so if the broker came across this 28 years old making 21 grand, he'd probably try to get him into a $100 a month plan with his short-term medical. Meanwhile, here is a $36 plan that is far superior. So this is just, you know, a clear illustration of what you got to watch out for. There are some really great plans in this system. Don't let your political leanings deter you from this, thinking Obamacare is bad insurance. And Obamacare is not insurance whatsoever. It is a subsidy program, and if you qualify, by all means, you should take it. Now, that's not the end of the story there. You know, you may not, maybe you're in the middle of this spectrum. Let's say that you're making $28,000 a year at 28 years old. All right, so now I've loaded up here these plans where if you're a 28-year-old making about $28,000. So the lowest out-of-pocket plan is probably not making sense, but $294 is still not bad. I don't think I would advise that, obviously, but let's go just back to a low deductible plan. And with a low deductible plan, the options that we have, it's a good plan right there at $26 a month. So even at $28,000 a year for this 28-year-old, we could get a fairly good plan, no deductible, good coverage overall. Okay, and again, we could delve into this and see the exact details, but I think you get the point there. Now, there are some tricks to working the system because they ask you to estimate your income. And so that's some of the things that when, you know, I work with my clients, I advise them on. There's certain ways that we can reduce your income that you report. And there's just, again, since they ask you to report it, you know, you may make anywhere from $28,000, you may make $21,000. There's a range there. You have to be careful and you have to understand what could happen when you misreport and what to look out for. In this case here, if I had someone that, you know, hey, they maybe work a lot of overtime, they don't know what they're going to make, well, I could say, let's say you're going to be down at that $22,000 potentially, but you get a plan with a very low out-of-pocket, very low deductible. If we make more money, yes, we'll owe that money back, but what they can't take back is all those benefits, those nice perks in the plan that we had all year long. And there's, again, this year we're kind of short on time. It's mid-year, but if you do have something like a surgery or some kind of heavy-duty medical issue that you're trying to take care of, now is a great time. We can get you in the system. Even if we have to pay for a high-price plan to get some of those better benefits, you could really take care of some medical issues or medical needs without really breaking the bank. It's going to be easier to carry this plan for 5 months. That's maybe $200-300 a month that takes care of a surgery than carrying it for 12 months. As for example, I had a client that we did something like that last year. We got him in about $300 a month plan, but he was able to take care of a knee surgery that would have cost him probably 40 grand. Typically, he got everything taken care of for about $2,000. So there's a lot of opportunity right now with all the special provisions. We're mid-year. It's kind of a good situation. If you don't have coverage, get in touch with me. We could set up a one-on-one discussion to go over your options. I put my calendar link in the description, so you can just add some time on that. Glad to speak with you. You can email me directly as well. That's also in the description. And if you've been watching the video, you'll probably see my phone number flash on the screen somewhere. Feel free to call or text me directly, and I'll be glad to speak with you and get you guys on the right path the way I just helped this other family. Again, don't let other brokers out there mislead you and have you pay for plans that you really don't have to pay for when you may be entitled to some of these great subsidies and discounts as well. So I appreciate you watching the video here. Thanks for viewing. Again, Insurance Insights, Insurance Simplified. I hope this made it easy to understand today. If you found the information in this video helpful, you know what to do.